Good evening, everyone. On thalassemia, I want to throw some light regarding one thing only, mainly. Actually, I think most of us, mainly the people of Bengal, we know very much regarding thalassemia and its inheritance. And most of us, majority of us, I can say, in our family, we can find carrier of hemoglobin beta thalassemia gene variant. So that we know, most of us, that if the father and mother both are being carrier or trait for beta thalassemia, then there is a 25% chance that our child may be thalassemia affected. That we know. And many couple who comes to clinic for counseling for their fetus, they want to take the decision regarding their fetus. They want to know whether the fetus will be affected or not affected, and again they want to know whether blood transfusion will be required or not. In this regard only, I want to tell a very few things. That is, just by knowing, when we come to know that, like I'm considering myself, that I and my husband both are carrier for beta thalassemia, then we plan, okay, if we have the information, we plan like that. We will not plan our baby, or sometimes we plan like that, we will have our baby, but prenatal testing will be required. First we try to know that whether our baby will be affected with thalassemia or not. After knowing that, we will take the decision. And usually we don't do anything when the times come for testing, invasive testing, for prenatal invasive testing, CVS or amniocentesis. Then we visit the clinic and we ask the clinician, fetal specialist, that we want to check that our fetus will be a thalassemia affected one or not. And whenever we come to know that the child inherited both the variation from us, then we consider that he or she will be affected, and most of the cases, usually parent take the decision of termination. But don't take decision like that. After knowing that the couple, that you and your husband, or you and your wife are carrier for beta thalassemia trait, then proceed for molecular genetic diagnosis. That is, what kind of variation you are carrying. If you find that as HBE, that is in hemoglobin beta chain, at 79 position, the G that is supposed to be there changed to A, and both of you are carrying that variation, only 79 G to A, then I will tell you that you can plan for pregnancy. Because if both the variant, that is the A allele, is being inherited to the fetus from both of you, then only the fetus can develop a mild hemolytic anemia. No regular blood transfusion usually is required in that case. So you can take the pregnancy, you can carry forward the pregnancy. No need to proceed with medical termination. And there are several other variation in HBB gene, like that. If one of you carrying beta thalassemia trait, the trait is of beta plus type. That is the trait, the variant may be beta 0 type, beta plus type. In beta 0 type, no hemoglobin beta chain is being prepared in you from that gene where that variation is there, beta 0 variation is there. In you, as you are a carrier, there is another gene is there which is carrying the normal situation. So you are being supported, and only minor, except minor anemia, no other phenotype should be there. But if that beta 0 is being transmitted from both of you, then the child will be majorly affected. Regular blood transfusion will be required in him or her. So you need to know the variant. If you are a beta plus kind of carrier variation, that is of beta plus, some amount of beta globin is being synthesized in you, and your partner is a trait that A2 is increased in the hemoglobin electrophoresis HPLC. A2 peak is increased, it is above 3.54, 4.1 something. You may be of HBD Punjab variation, you are carrying that genetic variation. In that case, again, prenatal test is not required. Your child be almost will be normal, will be mild anemia kind of thing may be present. So you can carry forward the pregnancy again. There are other variant also in our population. It is I have found in my patient only, that is Fanin-Lubbock variant. In that case also clinical intervention is not that much required. So prenatal test is also not required. So in all those cases, you need to know which kind of variation you are carrying. Like in some variant, we may find that HbE peak is high. Along with that, HbF, that is a fetal hemoglobin peak, is also high. In that case, we need to know that whether this increased level of fetal hemoglobin in the adult individual, whether that is due to a deletion in the HBB gene, or that is due to any single nucleotide chain sequence change in the promoter of HB gamma. So if it is due to the SNP1, then that will not be that severe. No blood transfusion will be required if it is being in homozygous stage also. So from both copies, that HPFH single nucleotide variation are there in the baby, then also regular blood transfusion will not be required. But if that HPFH phenotype, that is increased fetal hemoglobin in adult situation also, that may due to a deletion in the beta globin gene, in that case the phenotype may be intermediate type, may be transfusion required or may not be. So you need to know the probable phenotype based on the genotype. So first you need to know the genetic variant which is present in the parents. So just know that you are a trait is not helping you or not make you take the decision whether prenatal test is required or not, whether the fetus will be blood transfusion dependent or not dependent. Only if you go through the HBB gene sequencing in the parents, then only you may come to know that whether both the variant, that is the 25% chance of it, is present in your fetus, in your baby, it will resulted into which phenotype. So I will ask that before planning the pregnancy in preconception stage, you proceed with, if you come to know through HPLC that you are a trait for beta thalassemia, you are a carrier for beta thalassemia, proceed with HBB gene sequencing. Then the picture will be clear to you whether you need to be anxious or not, what will be the probable phenotype in your child. So please proceed with that before conceiving the child. Thank you.